Hi, I'm Danielle, and today we are going to take a look at the psychological, social, and biological explanations for schizophrenia, and also take a look at some of the issues in assessing the current treatment methods used for schizophrenia. So, schizophrenia is a multidimensional disorder that impairs a person's ability to manage their emotions, think clear and logically, and to relate to others. There is currently no cure for schizophrenia, however, it is a fully treatable condition currently affecting 1% of the population. Schizophrenics generally present with symptoms such as suffering hallucinations, delusions, and hearing voices in the mind. Onset of symptoms generally occur in late adolescence, with men being slightly more at risk of developing the disorder than women. Schizophrenia was once considered untreatable, but extensive research spanning a 25-year period has identified that 48% of people were responding well to treatment and living fully functioning lives, the most commonly used medication being antipsychotic drugs. According to the DMS-5, for a diagnosis of schizophrenia to be made, 2 or more of these symptoms should be observable for at least 1 month. At least one of these symptoms should be from the first 3, and these are delusions, hallucinations, disorganised speech, grossly disorganised and or catatonic behaviour, and any of the negative symptoms associated with the disorder. So the biological explanations for schizophrenia are generally categorised into 4 parts: genetic factors, brain structure and early development, biochemical factors, and evolutionary explanation. So we're going to take a more in-depth look at each of those now. Family studies have shown that the risk of development tends to be higher if you have a blood relative with schizophrenia. The chance of development increases the more genes you share with a relative, such as those who have a twin sibling. Which brings us to twin studies. Statistical research conducted by Gottsman and McDermott proved to be important in identifying the genetic link between the development of schizophrenia. For example, monozygotic twins have a 48% chance of developing schizophrenia if one twin already has the disorder. Moving on to brain structure and early development. Modern brain imaging techniques enable us to observe changes to the brain structures from disorders such as schizophrenia. Like Alzheimer's, schizophrenia is a brain degenerative disorder, with type 2 in particular manifesting in large ventricles within the brain. Schizophrenia affects many structures of the brain, including the front and cerebral cortex and some of the limbic system, including the amygdala, thalamus, hippocampus, and septum pellucidum. Some evidence suggests that prenatal exposure to viruses such as influenza can contribute to the development of the disorder. Biochemical factors. Research implies that the neurotransmitter dopamine is involved in the development of schizophrenia. Speculation around dopamine excess or oversensitivity at the receptor sites suggests a possible cause for the disorder. The original dopamine hypothesis, developed by Arvid Carlson in the 1960s, suggests that symptoms of schizophrenia arise due to hyperactive dopamine transmission. Some evidence of this lays in the successful use of antipsychotics to treat schizophrenia, dopamine transfer blocking drugs such as L-Dopa, for instance, which appear to reduce a lot of the positive symptoms of the disorder. Excess of the neurotransmitter serotonin is also considered, as well as the possibility of an imbalance between the two, both dopamine and serotonin. Evolutionary explanation. Evolutionary speaking, Stephen Price 2000 suggested that the function of schizophrenia is to facilitate group splitting, proposing that those who develop schizophrenia did so to act as leaders and enable subgroups to break away from the main group. The theory implies that some of the symptoms of the disorder, such as hallucinations, bizarre claims and beliefs, and delusions of grandiose, possibly led to others following the individuals with schizophrenia, believing them to know more. However, some of the symptoms of the disorder don't quite align with the theory, such as the lack of emotions, motivation, incoherent speech, and apathy. Which brings us to shamanism. Shamanism is a religious term derived from the Evenki language of the indigenous people of southern Siberia. Shamans are believed to be powerful beings who possess special powers capable of healing, contacting the spiritual realm, and guiding lost souls to the afterlife. Some liken shamanism to schizophrenia in that both can be described as altered states of consciousness. Theorists have also demonstrated parallels between the two in regards to the psychotic symptoms present in both. The psychological explanations for schizophrenia can be categorised into behaviourism, psychodynamic, and cognitive. And again, we'll look a little bit more into each of those. The behaviourist approach proposes that schizophrenia is a result of environmental factors that eventually lead to the improper functioning of the brain. Behaviourists have implied that some of the symptoms of schizophrenia invoke sympathy and positive attention from others, which can further encourage and reinforce false perceptions and repeat schizophrenic presentations. This can be explained using Skinner's 1948 operant conditioning theory. This approach favours nature over nature, believing that the modification of behaviour can be predominantly learned and therefore unlearned. The cognitive approach focuses around the concept that our emotions and behaviours are predominantly linked to the functioning of the brain. Psychologist Christopher Donald Thrift's 1992 theory suggests that a number of significant cognitive factors fortifies the development of schizophrenia. Some of Thrift's 1992 proposals suggest that schizophrenic positive symptoms such as delusions and hallucinations are a direct result of the individual's struggles with self-monitoring, which can cause the sufferer to mistakenly believe that their actions and intentions are the instructions of another. For example, auditory hallucinations. Thrift also theorised that sufferers had difficulties with misinterpretation of communication, which could explain the symptoms of paranoia. Psychodynamic. To explain the psychodynamic approach, we must first look at the psyche as a division of three: the ID, the ego, and the superego. We will briefly look at each stage and the time frame in which they develop before applying the theory. The ID is said to be present from birth. The ID is the inherited, primitive, impulsive nature of the psyche, made up of behaviours which are programmed from birth to ensure survival, such as the biological reflexes like coughing and blinking. The ego is thought to develop from the age of around 1 year old and is the part of the psyche that forms rational and logic. It helps to keep the ID in check by acknowledging the constraints and obstacles in the way of the ID's natural expectations. The superego refers to the final installment of the psych development stage. This part of the personality typically develops between ages 3 and 5, but may not fully develop until early adolescence. Values, norms, principles, and behavioural expectations are all formed in this stage, and like the ego, it assists in inhibiting impulses driven by the ID. The psychodynamic explanation of schizophrenia suggests that the disorder develops if the ego is compromised. Freudians propose that in some case of abnormal upbringing, this can weaken the ego and impact its ability to keep the ID's demands in check. The ego's attempt to control the ID can cause it to break, so to speak, and leave the psyche vulnerable to being overtaken by the ID and presenting with erratic behaviour. The social explanations of schizophrenia can be divided into life events, interpersonal family communication, and social causation. So looking at life events, Brown and Braley consider the contribution stressful life events can have on the development of schizophrenia. In particular, their studies highlighted the influence of family life on the course of the development of schizophrenia. Many studies have reported that a number of schizophrenic diagnosed patients reported significant life events in the weeks leading up to the schizophrenic episode. Stressful events can refer to marriage breakups, financial loss, loss of a job, loss of a loved one, However, the theory has been raised that some of these difficult life events could in fact be consequences of the disorder rather than causes. The interpersonal family communication theory focuses on the difficulties families face with engagement and connection with each other. The highly expressed emotion model refers to the conflict expressed within the family environment. Negative emotional engagement such as hostility, criticism, contempt, anger, and aggression are the kind of emotions that are measured to determine if they contribute to the relapse in schizophrenia. Kavanagh, 1996, proposed that individuals suffering with the disorder were likely brought up in families with a high level of expressed emotion. Social causation. Social causation is our final explanation for schizophrenia. This refers to the unequal distribution of the disorder across the world. For instance, in countries such as the UK and USA, individuals of ethnic minority or from poor neighbourhoods, Afro-Caribbean communities in particular, appear to show higher rates of developing the disorder than those from white middle-class backgrounds. Additionally, case records report a high percentage of schizophrenia sufferers living in urban and inner city neighbourhoods. The graph demonstrates the rising number of people living in urban areas worldwide, meaning people are living in much closer proximity to each other in much denser living conditions, which could be a major stress factor. This highlights the ethnic and economic factors involved in the development of schizophrenia. Cooper, 2005, demonstrates examples of social causation in his studies on the correlation of migration and psychosis. Which moves us to the second part of the presentation, where we discuss the difficulties in assessing the effectiveness of treatment of schizophrenia. So some of the treatment methods we are going to discuss are drug therapy, electroconvulsive shock therapy, behaviourist intervention therapy, cognitive behavioural therapy, yoga and mindfulness therapy, and family system therapy. So drug therapy. Biological treatments of the disorder can include antipsychotic medication. These are normally categorised into typical and atypical antipsychotics. Typical antipsychotic refers to the first generation of antipsychotics developed in the 1950s, with atypical being the new generation of antipsychotics developed in the 90s. Neuropleptics and dopamine blocking drugs that are effective in managing the disorder include piloxine, aldol, thorazine, and perfenazine. Side effects can include drowsiness, nausea, headache, and insomnia. Approximately 15% of patients do not respond well to treatment using antipsychotics, which moves us to the next treatment of electric convulsive shock therapy. This method involves the triggering of controlled brain seizures in an attempt to reboot the brain circuits into functioning normally. A controversial method with lots of speculation around the effectiveness and one of the least used methods of treatment, especially since the introduction of antipsychotics and their proven effectiveness. Behaviourist intervention therapy. Behaviourist intervention therapy is based around the concept that behaviour can be shaped, the concept that the individual seeks to maximise the benefits and eliminates the costs. This is measured by the individual's perception of benefit and cost and based around the individual's wants and needs. This method uses social skills training to try and influence new behaviours and unlearn negative ones. Behavioural intervention cannot be considered an effective standalone treatment for schizophrenia and works better in combination with other management methods such as antipsychotics. Cognitive behavioural therapy. This is a really common treatment method, which I'm sure everybody's heard of, and it's used to unpick negative thought processes. It is a patient and therapist-centred treatment which helps the patient to unlearn negative thoughts and behaviours and learn positive ones. It is a proven effective treatment for schizophrenia. However, it is shown to work better. Let's just sort that out. Sort that slide. Apologies for that. So yes, it is shown to work better when working with other treatment methods, such as antipsychotics, or when the more severe symptoms of the disorder are already managed. It makes it an easier process. Yoga and mindfulness therapy. Holistic therapies focusing on breathing, muscle relaxation, and sometimes nutritional health have proven to become more popular in today's society for treating mental health. These practices are reported to alleviate stress and depression and boost mood. However, there is not enough evidence to show that these therapies are successful enough treatment on their own in the treatment of schizophrenia. They often work better, like the CBT, after the more severe symptoms are already managed. Family system therapy. This focuses on working with families to introduce a way of creating a healthy family dynamic. Studies have reported an increase in symptoms in individuals who lack a decent family support network. Effectiveness is entirely dependent upon cooperation from family members and the patient, and can be hindered if historical dysfunction has severed family relationships. That could make it difficult to use that form of therapy and treatment. Which brings us to the end of the presentation. Thank you. I hope the presentation has explained some of the potential causes of the disorder, and as well as highlighted some of the limitations in observing the effectiveness of the different treatment methods. Thank you. Ugh.